Stearns. I'm the Executive Director of NAMI New Hampshire, the National Alliance on Mental Illness here in New Hampshire. NAMI New Hampshire is a grassroots organization working to improve the lives of all people impacted by mental illness and suicide through support, education, and advocacy. Last year, we served over 40,000 folks, only made possible through the tireless work of our over 200 volunteers throughout the state. I'm really honored to be here today amongst this group of folks who are going to talk to you today about the importance of Medicaid expansion in our state. This group of advocates and individuals with lived experience are people who really understand the critical role that Medicaid expansion has played in helping Granite Staters to access essential health care. Currently, the Granted Advantage Health Care Program, New Hampshire's Medicaid expansion, provides insurance coverage for more than 93,000 Granite Staters and is set to expire at the end of this year. Without legislative action to ensure the program continues, 1 out of every 15 Granite Staters will lose access to critical health care, including treatment for mental health and substance misuse disorders. We know in the mental health and substance use disorder field that early intervention diagnosis is important in improving outcomes. We know timely access to care not only improves outcomes but saves lives, as does continuity of treatment. In fiscal year 2021, more than 7,000 unique users in New Hampshire sought substance use disorder outpatient services through Medicaid expansion. 7,500 engaged in medication-assisted treatment, and nearly 2,300 used the program for inpatient or residential treatment programs. Additionally, more than 11,000 Granite Staters used the program for mental health outpatient services. Over 26,500 obtained mental health-related medications, and nearly 830 were able to access critically needed inpatient care. My loved one is one of those Granite Staters who was able to access mental health treatment thanks to New Hampshire's Medicaid expansion program. Indeed, I stand before you today in what I consider to be my most important role, that of a mother. My child was first diagnosed with an emotional disorder at age 5, a serious one by age 8, and a serious mental illness by the age of 14. Raising my child was not an easy task, but parenting is not for the faint of heart. And frankly, we were lucky. My employer offered health insurance that covered my child, and he was able to access the mental health treatment that kept him at home, in school, and not in an emergency department or inpatient or residential placement. As my child grew up, there were many sobering realizations for me as a mother, that his path would often be different from that of other children because of his disability, that not everyone would be so patient with his somewhat different approach to life, that he might not always be able to work 40 hours a week for all of his adult life because of his illness, and that he might not have access to treatment one day. While he was growing up, that last one terrified me. My child had been a treatment success story. Despite some difficult times, he had never required a visit to an emergency room or a hospitalization. But without treatment, which he would lose access to without insurance, I knew too well what his path might very well be. He could decompensate, become unable to function, be at risk of hospitalization or even homelessness. Once that happened, after what would likely be a several-year period, he might very well be determined to be disabled and therefore eligible for traditional Medicaid because his mental illness had proved so disabling. 1 in 5 adults and 1 in 6 children in our state has a mental health disorder. Recent data indicates that half of all adults surveyed say they or a family member have experienced a severe mental health crisis. I know I am not the only mother to live with such concerns. I am certainly not the only mother to lose sleep at night fearing for her child's future access to essential health care. As my child approached his 26th birthday, that magic day where he would no longer be eligible to be on my employer-sponsored insurance, he and I sat down to apply for Medicaid expansion. Coverage for him, it was relatively painless. And just a few weeks after that, the letter arrived saying that he was covered. I read it and I wept. Since first becoming eligible for Medicaid expansion, my child has had periods when he has been able to work and has had his health insurance provided by an employer or been able to purchase it himself on the marketplace. When times have been hard and he has struggled, he has been able to access the mental health treatment necessary for him to live a full life through Medicaid expansion. For my child and so many others, it has indeed proven to be a safety net. To the advocates, the folks with lived experience, our New Hampshire policymakers who enacted Medicaid expansion in our state, and those who are moving forward legislation to reauthorize it without a sunset date. Thank you. Words cannot express the gratitude that this mother has for the safety net that Medicaid expansion has provided to my child. I know I am only one of many parents who feel this way, so thank you for helping to make me sleep a little better at night and for helping my child. It's my pleasure now to introduce Chris McCracken, the President and CEO of Amos-Keogh Health.
Take that off and hopefully it'll be easier for you to hear me if I'm using my outside voice. So good morning. Thank you all for taking time out of your day. We know how busy it is. My name is Chris McCracken, and as she was kind enough to share, I serve as the CEO at Amos-Keogh Health, and we are a federally qualified health center primarily serving Manchester and the 9 surrounding towns, although federally qualified health centers, or FQHCs, have no boundaries. We provide primary care, behavioral health, substance use disorder, prenatal care, and other supportive services to anyone needing care. And we're designed to be affordable and accessible, especially to those who might experience barriers such as living without insurance, which is such a privilege and a right. So we are particularly aware of the circumstances of the individuals in our state that need access to health insurance through Medicaid expansion. In our city alone, over 13,000 individuals have taken advantage of this opportunity to get health care access because of Medicaid expansion. Prior to that, the number of uninsured individuals in our state was absolutely staggering. Since expansion has occurred, many of the organizations that have provided this access, regardless of ability to provide their payments, have been able to expand care by growing their organizations to meet the needs of those individuals. Our organization alone has grown substantially and has been able to do this because of the change in people's ability to help pay for their own care. In 2014, we served just 11,000 patients, but last year we served over 15,000. We had 2 locations of care before expansion. We now have 5. In 2014, we provided 43,000 visits. This past year, we provided over 75,000 visits. In 2014, over 28% of our patients had no health insurance. Now, less than 22% of our patients are uninsured. We used to employ just 138 staff. We now employ 218 staff. And we are not alone. As was quoted just recently, the overall statewide average of uninsured patients has dropped from 19 to 12%, and Medicaid coverage has expanded from 30 to 34%, and commercially insured has increased from 32 to 35%. And there's been a 100% increase in those individuals receiving behavioral health, and a 443% increase in patients now able to access substance use disorder services. Many of the state's federally qualified health centers can now offer Medicaid-assisted treatment, and patients can access MAT and other SUD treatment services at those health centers across the state behavioral health services, case management, and other supportive services designed to help people navigate the system and increase their access to care. It's also got a financial impact. Healthy citizens are the solution to growth in jobs and economic development. FQHCs and other organizations that provide these kind of services to individuals are also employers, and we're actively seeking to grow the number of individuals we can employ. But I always think, as was recently shared, a human story is what tells this the best. I'm sure there's not a single person here who doesn't know somebody living with diabetes. It's a common disease, and it strikes so many of us. And my favorite story is one that one of our family practice physicians shared, Dr. Laura Fry, of a patient she has provided primary care to for over 15 years. And this gentleman is a construction worker, so guess what? No insurance comes with the job. And she started caring for him in his 40s, and by the time Medicaid expansion came around, he was in his 50s. And she'd always worked with him to try and control his blood sugars, try and get them into a better place. And they just never could get those numbers where they needed to be. And in 2014, she suddenly started to notice that his blood sugar started to come down. So that's that hemoglobin A1C for those of us who work in the field. And it talks about how controlled you are. And she inquired of him at the visit, wow, your numbers are amazing. What happened? And he admitted to her that he had been ashamed to say, well, the testing strips are really expensive. I can't test as often as you want me to, and I have to ration my insulin because it's just so expensive. And now suddenly he had coverage, and he was actually able to test as frequently as he should have, and he was able to take his medication when he needed it, and not in a less than therapeutic range. And as a result, suddenly, here we are, and his diabetes is in control. And that's the best kind of story, because that's the kind of disease that could end up with kidney failure. They could end up with loss of sight. They could end up with, amputations of a toe or a foot, or God forbid, a leg. That's a really expensive kind of endpoint to somebody not getting care. So in summary, the positive impact of the citizens of New Hampshire for Medicaid expansion is amazing, and I pray we're at a point where we can not only reauthorize Medicaid expansion, but do so without a time limit. So that removes that fear and that pressure every 5 years to go through this process, and all the individuals who face the potential loss of this benefit that they have come to use in the way that it's meant to be used. So thank you on behalf of all of the federally qualified health centers for your time and attention to this matter. Now I'd like to introduce Lisa Madden, who's the CEO of Riverbend Community Mental Health, to come up and share some of their experiences. Thank you.
Good morning, everyone. I also want to thank you for joining us today. I think we have some interesting stories to share with you. My name is Lisa Madden. I am the president and CEO of Riverbend Community Mental Health Center here in Concord. I also serve as the vice president of behavioral health at Concord Hospital. I'm here today representing the New Hampshire Community Behavioral Health Association, which is comprised of all 10 of the state's nonprofit community mental health centers, all of whom strongly support permanent reauthorization of Medicaid expansion in 2023. Medicaid expansion is a major legislative priority for the association and the centers. The benefits the Granted Advantage healthcare program for New Hampshire residents offers who need this level of care are significant. In collaboration with several community partners and state departments, the ease of access to such services has greatly improved. We have the Rapid Response Access Point, which simplifies the way one can access mental health services. The Doorway is a network of providers that simplifies the way one can access opioid and other substance use disorder treatment. Improving access is certainly a critical step, but having access to healthcare insurance through Medicaid expansion allows people to actually participate in treatment over the long term. As you heard from previous, the data from the Division of Medicaid Services is very compelling. We have 90,000 New Hampshire residents that are in part of Granted Advantage Healthcare, 11,000 enrolled in the program receive mental health care, and 30,000 use medication services, and 9,000 receiving substance use disorder treatment services. To support those numbers and to give you a little bit of a framework, I'd like to give a couple of examples of client experiences. We'll call one person Joe. He was previously uninsured, he was homeless, living in a shelter, and not engaged in treatment. Thanks to Granted Advantage program, He became a patient of the local community mental health center in April of 21. With the help of the CMHC staff, Joe was able to enroll in the Bridge program and began receiving case management services through that program. He has remained positive through his recovery, and now, 2.5 years later, he has his own apartment. He is employed and is actively focusing on his budgeting skills and working to be more independent. I'd also like to share with you a story about Bob. He is a young man referred to Concord Doorway from the Concord Hospital Emergency Department in the spring of 2022. During the assessment, Bob identified many barriers to staying engaged in treatment. He too is uninsured, unhoused, unemployed, and had a history of serious mental illness, including considerable self-harm. Bob eagerly completed the application for Medicaid with the assistance of the Doorway staff. The new parameters for the expanded Medicaid allowed Bob to be eligible for insurance. He was immediately referred to the Residential Substance Use Disorder Treatment Program, and he was admitted within 3 days of coming to the Doorway. Bob continues to make gains in his recovery. He's completed residential, partial hospital, and intensive outpatient levels of care, and he has moved into long-term recovery housing in the summer of 22. One more example I'd like to share is I know of a young woman who has suffered greatly with opioid use disorder. She has been extensively involved in the criminal justice system, and she's been incarcerated often for violating her probation due to substance use disorder offenses. She too was uninsured, unemployed, and estranged from her family. With access to Medicaid, she received treatment, is currently in recovery for 2 years. She is in stable housing and has reconnected with her family. This individual is active in 12-step programming, employed, and taking classes towards becoming a peer recovery support specialist. Without the Medicaid expansion program, Joe, Bob, and others just like them who have mental health and addiction issues would literally be out on the street. The program is a lifeline for many individuals in need of treatment, and it needs to be made permanent this year. While we are very heartened by public statements of the governor and legislative leaders supporting Medicaid expansion, we need to reach all of our lawmakers and emphasize how critically important the Medicaid expansion program is in providing access to care to people in their own communities. I join with the advocates here today to ask our lawmakers to vote yes to reauthorize Granite Advantage Healthcare in 2023. Thank you very much.
Good morning. My name is Keith Kinning. I'm the Advocacy Director at Waypoint. For children to be healthy and to thrive, they need healthy parents. As a service provider to both children and families, Waypoint supports Medicaid expansion, not only to support and maintain the health of New Hampshire's adults, but its children and overall communities. When parents gain coverage, they are more likely to enroll their children in coverage and take their children to the doctor. This was demonstrated and increased in well child visits for children in Medicaid expansion states. Children who had Medicaid coverage while the child was in utero had improved outcomes in health and education later in life. Research has shown that when adults' health care needs are met, they are better able to support and care for their children. For example, in some Medicaid states, expansion states, adults have reported that having Medicaid expansion has made it easier to look for a job and to maintain employment. In addition, Medicaid expansion has been associated with reducing the rates of child neglect. Evidence also shows that having health insurance reduces debt and improves families' economic security. Parents living in Medicaid expansion states reported reduced psychological stress, likely due in part to the reduced financial burden. Further, improvement of financial security also appears to be helping low-income families maintain stable housing by avoiding eviction and increasing home ownership. Having health insurance also increases parents' access to mental health care. This is crucial since untreated conditions such as depression and anxiety can impede a parent's ability to bond with and care for their children, which impacts healthy development. These are just a few of the demonstrated benefits of expanded Medicaid for children. As one policy brief clearly put it, children are left behind when states fail to expand Medicaid. Reauthorizing Medicaid expansion ensures that we do not leave New Hampshire's children behind. Thank you.
Morning, everybody. My name is Dave Juvet. I'm a Senior Vice President with the Business and Industry Association here in New Hampshire. I'm here this morning to express the strong support of New Hampshire's employer community for permanent reauthorization for expanded Medicaid. We have 3 reasons for this. The first is, it's not only the smart thing to do for New Hampshire, it's the right thing. By not reauthorizing this program, the result would be taking 50 to 60 to 70,000 people and removing insurance from their lives. That is not the right thing to do for New Hampshire. It's certainly not the best thing to do for public health in New Hampshire. The second reason is it's a workforce issue for New Hampshire employers. Our biggest concern right now is finding employees. Frankly, New Hampshire companies and the New Hampshire economy is growing faster than our ability to hire people. And we need to have a healthy workforce for that workforce to be employable. And then the third reason is the dramatic economic impact that it would have on the state if Medicaid expansion is not reauthorized. Not only would this be catastrophic for the state's hospitals, who are often the largest employers in the communities that they're located, it would be bad for the state. This state would be losing upwards of $500 million, that's $500 million in federal funding that comes into New Hampshire to help support Medicaid expansion. So we believe this is critical for the New Hampshire legislature to pass permanent reauthorization. It's not just a policy issue for the BIA, it is one of our top legislative policies this year. Thank you.
Good morning. My name is Amber McCory, and I'm from Dublin, New Hampshire. I'm a single mom of 2 kids. The people that have already spoken here today spoke passionately about the importance of Medicaid expansion from the perspective of specific topics like general health, business, families, and mental health. I'm here to tell my story, hopefully without crying too much, but no promises, to give an example of how that all ties together. A few years ago, while I was running an in-home daycare, I would randomly and out of the blue have unexplained extreme lung pain that would come on suddenly. My doctors didn't know where it was coming from or what to do. After running tests and exploring possible causes, the conclusions that the doctors came to is that I needed heart surgery. I had a pericardial cyst the size of your fist on my heart. How could I have heart surgery and take the month I needed to recover when I had an in-home daycare? How could I support myself and my kids financially, maintain my business, and be there for my daycare parents when they needed me as well? As a self-employed individual, that part would have been impossible without the help I received from family. But what would have happened if I didn't have Medicaid expansion at the time? I wouldn't have had the surgery, and I would have had to close the daycare, or my families would have understandably had to walk away to find more reliable care. My medical needs being met meant at that time that I could continue to contribute to society in New Hampshire, which in turn enabled others to continue to do so as well. In the middle of my healthcare crises, my daughter, who was 7 at the time, started... Sorry? She started randomly collapsing in pain while walking across the room to get a snack or a toy. She went from a physically active child to needing a walking stick, to arm crutches, to being a part-time wheelchair user. She was still as active as she could be, but it came at a cost for her. We now know that she and I have a genetic disorder called Ehlers-Danlos syndrome. We both know how important it is that all families and all people have health care they can depend on so that they can live their lives fully. If my needs weren't being met at that time, how could I make sure hers were? The needs of a family don't end at just our physical needs, though. Everything is wrapped up within our mental health needs. My kids and I have been in therapy for about 6 years now, and if that wasn't covered by our insurance, I don't know how we would be doing, and I can't emphasize that enough. My 12-year-old son has to deal with having a physically disabled mother and sister and manage his ADHD at the same time. ADHD can be a superpower, but only if you're able to mold it into one. He's juggling so much more than any child his age should. Medicaid expansion is a significant driving force behind my family's ability to navigate our life by providing me with the healthcare services I need. This just scratches the surface of what we've been dealing with the last handful of years. In the last 2 years, we lost our housing and my small business with it at the same time after the house we were renting was sold. My kids and I were homeless for 1.5 years up until just a couple months ago. Because the rent is too damn high. I can't imagine our medical needs not being met on top of everything else. The need to reauthorize the Medicaid expansion is not isolated to my little family. We're not that special. We're just a small example in this big country and in this state that illustrates the need. Please don't make things harder for my family and the tens of thousands of others just like us. I, along with my kids, deserve to have our medical needs met, no matter what they are. Thank you.
Thank you, Amber, for sharing your personal experience. It's a privilege. Thank you. We do have time for a few questions, if there are any.
Have you heard anything from lawmakers to oppose this, and what are their arguments, and how would you counter them?
I'm going to defer to my colleagues. Have we heard from lawmakers who oppose this at this time?
I can partially respond to that.
Please.
In November, the BIA hosted a leadership summit, which was designed to bring New Hampshire lawmakers and the business community together. And we do a series of workshops. One was on permanent reauthorization for Medicaid expansion. And of the many legislators who were there, I didn't hear one who outright opposed it. There were a lot of questions, which is, I think, to be expected. But I didn't hear any opposition, especially widespread opposition, and we're looking forward to this to be a bipartisan effort that brings Democrats and Republicans together on an important public policy issue.
I think, Adam, you had your hand up?
That pretty much covered it.
Okay.
I just had a quick question about the amount of money that is going out, and is it coming from the general fund? It's obviously 90% is federally, but where is the other 10% coming from?
I have not yet, and I'm going to look and see if anyone has seen the language particular for this bill. We do not yet know that. I understand Senator Bradley has filed a bill that he is sponsoring, and so I would suggest maybe that's the first place to direct those questions.
But should there be a dedicated revenue source to support state funding?
It's this. Do you want to answer that question? I can tell you what I think, but.
Sure. Good morning, Jake Berry, Vice President of Policy at New Futures. Thank you all so much for being here. To get back to the question Paul you had a second ago, so general funds are not currently going to cover Medicaid expansion. There's a prohibition on using general funds. To cover for that, currently the state is tapping a number of different funding sources, including the alcohol fund, which is determined by statute to support prevention, treatment, and recovery programs across the state. I can certainly say that speaking for New Futures, we feel strongly that the alcohol fund should not be used to contribute to to cover the state share. That funding is just crucial to, again, supporting treatment, recovery, and prevention programs all across our state. There are a variety of other options that are available. Certainly we would leave it to our legislative partners to figure out what the best source is, but we would love to see it not not come from the alcohol fund. I don't know if that addresses the question, Kevin.
Probably have time for one more. All right. Thank you all very much.
Thank you.